It's all relative, supporting Kinship Connections. Logos for the Capacity Building Center for States and the Children's Bureau. National Foster Care Month 2018, May 14th, 2018.
Hi everybody, and welcome to the 2018 National Foster Care Month webinar. It's all relative. You're going to hear from some great folks today. In just a moment, I'm going to turn it over to David Kelly of the Children's Bureau, and then you'll hear from Taffy Campaign, who is our National Foster Care Specialist with the Children's Bureau. You'll see me there on the screen. I'm Jennifer Marcelli. And then we're going to go into our presentation. You're going to hear from some great presenters from Colorado and Ohio. So from Colorado, you'll hear from Tyler Allen, the Title IV-E Waiver Administrator, and Jeannie Brzezinskis, the Kinship Care Program Administrator. And then you'll hear from Tim Harless, the Director of Community Outreach and Programming in Richmond County in Ohio. So we're really looking forward to a great webinar and a great day. And I'm going to turn it over to David Kelly of the Children's Bureau for a few comments. David?
Children's Bureau Vision. More information is available on their website at https://www.childwelfare.gov/fostercaremonth.
Thanks, Jennifer. I'll be very brief. Good afternoon and welcome everybody. On behalf of Associate Commissioner Milner, I'd really like to thank everyone for making the time to join today. Foster Care Month is a time to recognize all the caring professionals and providers and families step up to help when it's not safe for children to remain home. We're truly grateful to all of you. It's also a time to challenge ourselves to envision a system where out-of-home placement is less necessary. And while there always will be a need for foster care, we'd like to ask everyone to envision a day when that need is much, much lower. We think we can reduce the need for foster care by working further upstream in preventative ways to help strengthen all families and help prevent maltreatment from happening in the first place. Where removal is necessary, we think the evidence is clear that kinship care should always be the first choice. And where kinship care is not possible, we want to ensure the highest quality of foster care for those children and families that need it. We envision foster care as a service to families, something that promotes the well-being of biological parents and children, as opposed to just a substitute for parents, as we sometimes conceive it. We also know it's absolutely vital that all who perform these services for families and kids, all who step up, have the support they need to do it. And that's something that we're very committed to doing better. So for that, let me step out of the way. There's a very exciting program ahead of you. I'd like to thank our presenters, the Center for States, and my colleague, Taffy Campaign, for her leadership in this area. And would like to turn it over now to Taffy to begin the program. So thank you, everyone.
Logo for National Foster Care Month 2018. More information about National Foster Care Month is available at https://www.childwelfare.gov/fostercaremonth.
All right, thank you, David. Hello, everyone, and welcome to our National Foster Care Month webinar. It's all relative, supporting Kinship Connections. My name is Taffy Campaign, and I'm the National Foster Care Specialist at the Children's Bureau. As you all know, in May, federal, state, local government, as well as our many partners, acknowledged the individuals and entities who help children and youth in foster care find permanent homes and connections. And it's also a time to recognize the need to help now more than 430,000 children and youth in foster care across the country. So this year we're recognizing the incredible contributions kinship caregivers make in caring for children and maintaining family connections, and also in supporting the reunification of families. The Children's Bureau supports National Foster Care Month through a dedicated website that offers comprehensive information and tips for parents, youth, kinship caregivers, foster parents, guardians, tribes, communities, and of course for child welfare professionals. For example, through our real life story section, We share insight into the diverse faces of kinship caregivers, such as a retirement age couple who assumes care of their 3 young children, grandchildren, while their daughter enters an addiction recovery treatment center. And also there's a story of a young graduate who defers her professional advancement to care for her niece. So there's some very important lessons in the stories that we have in that section. And we've got other sections as well. We also offer a spread the word section that offers a toolkit to help child welfare professionals and the community advocates engage the public through outreach and social media activities. So this year, the website provides resources and tips. Just to name a few, for kinship caregivers, we have information including how and where to find support, state kinship care contacts and Kinship Navigator program contacts, and resources for both formal and informal kinship care. We also have resources for non-relative caregivers, for parents, for youth, for community, so please do visit our website. As you see on the screen, there's the home page as well as the website address. So please visit the site and support our promoting the efforts and the importance of relative and kin caregivers. Thank you so much for attending. We really appreciate you being with us today, and I'll turn it back over to Jennifer Marcelli.
Thank you, Taffy. All right, everybody. So just quickly, I want to run through the agenda for the day. You just heard our introductions, and then in a moment I'll be letting you know our objectives for today's webinar. And then you will hear from Richmond County, Ohio, and then from Colorado. And then I'm going to do a brief overview of a great learning experience that the center has developed based on some digital stories that we did with kinship care providers. And then we'll move into question and answer session. So throughout today's webinar, please feel free to chat in any questions that come up throughout our presenters' time, and we'll make sure that we come back to those at the end. And then we'll also have an opportunity for folks to come on the line and ask questions if they would like as well. So moving to our objectives for today, here are our goals for you all: that you'll be able to identify strategies and supports that facilitate kinship care options and foster care placements. You will be able to recognize best practice examples in kinship care programs and be able to identify strategies for using available resources and community partnerships to support kinship care programming. And before we move into the presentation, we just wanted to just do an overview of defining kinship care. And so we have the definition on the screen, which is really a temporary or permanent arrangement in which a relative or non-related adult who has a long-standing relationship or bond with the child or family has assumed the full-time substitute care of a child whose parents are unwilling or unable to do so. So as we move forward into today's webinar, we hope that you all have learned some really great new things and asked a lot of great questions. So with that, I'm going to turn it over to Tim Harless. So Tim, it's all you.
Thank you very much. First of all, let me say that I'm excited to be part of this webinar today. My name is Tim Harless. I'm the Director of Community Outreach and Programming for Richland County Children's Services. I've been in child welfare for going on 29 years now, and I know all of you out there, professionals that wear many hats. The one that's been most rewarding to me over the past 17 years is the kinship hat that I get to wear. I believe we offer a very robust program here in Richland County, and I'm going to talk a little bit about the 4E waiver and what it has done for our county. We are not a statewide waiver where there's 15 counties involved, but we've done some really significant things in our county in reducing the number of kids that are not only in foster care, but in congregate care as well. In some of the slides, I'm going to go over some of them. I may read from them, and I may not. I may just expound on some of the points that I feel are important to all of you out there. So, again, I'm so happy to be part of this, and hope you learned something from us today. So with this first slide, I'm going to skip the Kinship Navigator and make that last because I think that's really most important in what we've been able to do here in Ohio. Let me preface that by saying Ohio is a legacy state regarding the waiver. We've been part of the 4E demonstration project since 1997. We all know that those are set to end September 30th, 2019. and the Family Services Prevention Act is now law, and we're going to have to make some changes, but there is some flexibility, so that's a good thing. And I will get into a little bit of that later on in my discussion. Part of Protect Ohio kinship strategy requires all of the counties that are involved to have identified kinship coordinators that all get the same training. That provides consistency to the model, fidelity to the model, which we've heard from our evaluators numerous times, and it's been something that we think has been important for us moving forward, that we're all kind of doing things in a similar fashion for the kinship families that we work with. We do have some kinship-specific assessments that we complete. There's a home study, Part 1 and Part 2, that's required, and these are cases that are transferred from intake to ongoing, and we follow those families. There's also a family resource scale that we do every 90 days with the family, and that's really to review what kind of services are we put in place. So that initial assessment that we do with the family, there may be needs that they have that we have not addressed or that they need addressed. And as we continue to do those family resource scales, what we're hoping to find is that a lot of those needs are either completely dissipated, or we've been able to address the problem and they no longer have that issue, and all they're really needing is some support from us once in a while. So some counties, some of the 15, provide a kinship caregiver handbook that is specific to their county's resources. I'll talk a little bit about community mapping, something that we really value here in our county that we put together for all of our kinship caregivers, and it's part of our 211 system as well. And then training for kinship caregivers. We've actually offered and opened up some of our foster care training for our kinship caregivers to deal with some of the kids that we're placing with them. Let's face it, if a child has to be removed from their biological family, and we all need to work on reunification, that's our #1 priority. But when children can't, we need to make sure that the caregivers are prepared for the trauma those kids are a part of. So we want to get them any training they feel would be necessary, or it would assist them in raising these children. And, you know, the one thing that I've noticed with a lot of the families that we work with is we seldom are placing just one child, often placing sibling groups with these folks that are on fixed incomes and struggle. And just to say, here you go, here's your, your grandchild or your niece and nephew, good luck, hope it works out, it normally doesn't work out. So, we try to assist as much as possible. The flexibility of the waiver has allowed us to do some pretty miraculous things in our county since 1997 to current. So, getting back to the Kinship Navigators.
A table labeled Support Access to Resources. The left column includes the following: Information and Referral, Case Management Assistance, Kinship Support Groups, Mental Health Services, Substance Use Disorder Assessment and Treatment, Legal Services, and Kinship Permanency Incentive. The right column includes In-Home Services, Basic Hard Goods and Purchases, Home Management, Housing Assistance, Transportation, Financial Support, and Child Care.
Years ago, there were TANF dollars out there that allowed almost all 88 counties in Ohio, we have 88 counties here in Ohio, to provide some sort of Kinship Navigator service. When those dollars dried up, many of those programs went away, to the tune of today, I think there's, probably only 5 really valid, valid programs that are available in the state of Ohio, Richland County being one of them. We're a population size of about 121,000 people. As of about six years ago, we were as low as 44 kids in our agency's custody. In 1997, when we started the waiver, we had over 280 kids in our agency's custody. So we were drastically able to reduce the number of kids in foster care and in congregate care by having flexible dollars to work with these kinship families and provide some permanency for those kids, along with identifying with their family's culture and ethnicity. So the Kinship Navigator program, I was able to convince our board that we needed to continue the program despite the funding loss. And I'll show you how I did that a little bit later in the slide. It was some manipulation on my part, but I think when you see some of the numbers, you'll understand why they said, yeah, absolutely, we need to do it. And in fact, about 3 months ago, we went from 2 navigator staff to 3 navigator staff in our county. So moving on. So the Protect Ohio Kinship Manual is part of the strategy that we have, and we have 2 here in Ohio. part of the waiver. One is family team meetings. The second is the kinship strategy. Again, we felt it important that we developed a manual that everybody would follow, everybody understood. All of the kinship coordinators in all of those counties that participate in the waiver would be doing a lot of the same things within their county so we can meet model fidelity. In order to do that, we did develop a manual that we'll make accessible. There'll be an area where you can see that resource later on in the PowerPoint. It is available online. Every staff member that participates in the kinship strategy in all 15 counties are trained in the manual. We did find it was difficult for some of our kinship staff to travel out of their county to get this training. So we actually created a web-based training that they can complete online that has both a worker manual and a supervisor manual so they can discuss what they've learned in each module, and they can take it at their own pace. Lastly, there are quarterly meetings. I lead those meetings for Ohio, where all of the kinship coordinators either meet in person or we call in just to talk about what's going well, what are we struggling with, what may be working in some counties that are not working in others, and so on and so forth. So those have been very helpful, and I've led that for about 4 years now. So again, Protect Ohio Kinship Supports, and this is important to understand because not all counties that are part of the waiver instituted navigators. We thought it was important in Richland County to continue to operate navigator programs, but just having the flexibility within a county has offered a lot of kinship families the support they need to keep those kids in their home. Many of our counties offer either monthly or quarterly support group meeting. I do know here in Richland County what we try to do is encourage the kinship caregivers to come up with ideas that they want to understand or they want to learn about. So it's not us dictating what's going on in the support group meeting. They'll come up with, if their kids are getting close to college age, we'll bring in some colleges, we'll bring in some high schools to talk about IEPs, we bring in nutrition experts, we're bringing in some of our mental health service providers, drug and alcohol service providers, and then if there's counseling needed for the kids and the caregivers as well, because a lot of times they're not only worried about their grandkids, but they're worried about their biological children as well, so they're kind of torn there. So we make sure those resources are available to them. We assist with those services, so if they're struggling to find some of those places, we will help identify them for them. We've taken caregivers to appointments. We've set up appointments for them. If need be, obviously the formal and informal, and I'll get to those in just a few seconds, but we do deal with informal families as well. The formal families, we'll absolutely make sure that they find the resource within our community if it's available to them. And we provide follow-up calls to all of our kinship providers who contact our navigators regarding a request, and we track that in a spreadsheet. I just did a semi-annual report not too long ago and found that we had over 600 contacts with kinship families from October 1st through March 30th, October 1st of 2017 to March 31st of 2018. So those three folks are super busy. We do provide a newsletter, a quarterly newsletter that provides information about what's going on at Richland County Children's Services, what's going on in the community, any school-related, there may be some school supply things that are provided. There may be some information on some things going on in our community that may support them, as well as some little tricks and tips on how to deal with kids' behavior and things around trauma. And those go out on a quarterly basis. Kinship care as a placement option. So we do have an evaluator. That's part of the strategy. And what they have found in the data over an extended period of time, and we're really excited about some of these findings, children placed in out-of-home care in counties implementing kinship supports were significantly more likely to be placed initially with kin, avoiding temporary foster care placement, than were children in comparison counties. So let me go back and discuss that just for a second. So there's 15 demonstration counties and 15 comparison counties, those that do not offer the same strategies that we do. Many of you will be familiar with that, but I wanted to make you aware of that as well. So they compare us to counties that don't have the same strategies that we do, and that's where they've come up with some of this very important data as far as we're concerned. they spend the majority of their placement days with kin than were similar children in comparison counties. And that's part of the Human Services Research Institute evaluation brief they did in July of 2016. They've been our evaluators through the entire waiver process in Ohio. Kinship care versus practice as usual. Children in kinship care whose families received intervention services, and again, this is data that we've received, and these are significant points that that HSRI was able to provide to us. They experienced greater placement stability, significantly fewer placement moves than children placed with kin in comparison counties, and they reached permanency in significantly fewer days than children placed with kin in comparison counties. We believe that's a direct reflection of the waiver and our ability to implement those strategies and meet model fidelity to ensure that those caregivers are receiving the services they need, so those children are stable and know that this is where they're going to be. And all kids need a stable environment. We know, and I'm not here to say anything negative about foster care, because foster care is very important, but we know if a child struggles and doesn't do what they need to do, sometimes kids can bounce from placement to placement, and we're finding that's not the case with a lot of our kinship placements currently. Kinship care versus traditional foster care. Children placed in kinship care are experienced greater placement stability, fewer placement moves than children in foster care in comparison counties, reach permanency in significantly fewer days than children placed in foster care in comparison counties, were significantly less likely to experience abuse or neglect after exiting than children exiting foster care in comparison counties, were significantly less likely to re-enter out-of-home care after exiting care than children placed in foster care in comparison counties. And again, we believe that is a direct reflection of the supports that we're able to provide many of our kinship caregivers that without that flexibility we would not be able to provide. Part of the thing we struggle with the waiver here in Ohio is there's a lot of counties outside the waiver that are interested in what we're doing, but in order for HSRI to get positive data, we really haven't been able to share a lot of what we've done within the strategies. And we're looking forward to when the waivers end that a lot of that information is going to get out there, so many more kinship families can be supported with the kids that are placed in their homes. So this is, when you talk about research and you talk about statistics, we can go on and on and on and on, but it really shouldn't be any shock to all of us that kids that are placed in kids that are placed in kinship care have better school attendance, they have better grades, and they have fewer community problems, i.e. with their juvenile court. Now let me say this too about juvenile court. One of the things that you really need to do, and what we've been able to do in Richland County and other counties in Ohio, is you got to have conversations with your judges and magistrates. In many counties I've talked to, judges and magistrates will say, well, you know, agency, you receive custody and then you can place wherever you want with the child to be. We all know then if the caregiver does not become a licensed foster parent, you're not going to get any reimbursement for that child at all. But we had really lengthy conversations with our judges and magistrates, and they will give temporary custody to our relatives, and then also they will go legal custody after 1 year if the reunification process with the biological parents does not occur. Now that took a lot of work. So, and then expounding on that a little bit further, I talked about the informal families we work with. I believe we have about 162 open cases currently in our agency that have probably 180 or 90 kids that are placed in kinship care. We deal with over 380 informal families, which means because of the waiver, because of the flexibility, you don't have to have an open case to work with our agency. You can contact us, and we will provide the same amount of service that we do a formal family. We find resources in the community for those folks, and we keep them out of the front door. A lot of those families don't want to be involved with children's services. They're kind of afraid of us. They still have that stigma that, oh boy, if I get involved, I'm going to have a problem. Our caregivers, that's not the case. We've been very proactive in getting the message out and letting them know that we want to provide stability for those kids and their family.
A table showing Richland County Cost Comparison 2016. A table breaks down the cost comparisons between children in custody and children in kinship care. For children in custody, the placement average was 81 children. The costs associated are regular foster, $488,294.32. Daycare, $91,191.44. Intensive purchased, $396,310.10. Travel/clothing, $65,131.40. Intensive local, $15,379. Exceptional/special foster care, $56,424. Average cost per child, $15,409.65. For children in kinship care, the placement average is 262. The values are Kinship ESAA payments, $68,971.49. Kinship legal expenses, $68,655.45. Kinship permanency incentive, $156,525. Average cost per child, $1,122.72.
So here's the document that I was talking about a little bit earlier. And my finance director gets really upset with me when I do this, but I've done it every year for probably the past 10 years. I asked him to take an average number of kids we had in custody for an entire year. And in 2016, we had 81 kids that were in custody of the agency for an entire year. Now, you can look at all of those expenses that were spent on those kids that were in foster care, to the tune of 81 kids costing $15,409 per child. Then I asked him to run numbers on both formal kinship children that the agency has provided some services for, and then some informal families as well. Kinship ESA payments, that's funding that we utilize within the agency to help these kinship caregivers with rent, utilities, whatever you may have. The second one is really something that I believe only Richland County in Ohio really does. And what we found was with kinship caregivers, they'd go to juvenile court and request a power of attorney or a caregiver affidavit or want to understand something about custody, and they're not given any assistance. So myself and my Kinship Navigators went out into our county, and we found some firms that were willing to work with us, and they provide some kinship legal services to our kinship parents. And those are both formal and informal referrals. I review the formal referrals with our internal agency attorneys, but many of those families receive assistance from those two law firms that we have. They help them complete paperwork. They'll give them certain legal advice. They'll talk about legal custody if need be. We do have them sign a release that I check with our attorneys to make sure that we weren't going to get ourselves into trouble, because we do talk about background checks and things like that we're going to have to do with the informal kinship caregivers, maybe some SACWIS checks. They sign that, and then we continue to work with them. So that was $68,000 that otherwise we wouldn't have if we didn't have the waiver and the flexibility. And then our state offers something called the Kinship Permanency Incentive Program. It's eight payments over a period of time. The first payment's $525, and then they receive $300 for each child every 6 months thereafter. But it's not a lot of money. So again, if you look at 262 children, the cost for those 262 children per child was $1,122.72. So I take this information to the board, not to be a smart aleck or anything like that, but it's just factual. That's the cost. If we can keep kids in kinship care, it greatly reduces the cost of the agency. Again, the child remains with their caregiver, with the family's ethnicity and culture. So I utilize that slide wherever possible just to show the savings that we've had within Richland County because of the flexibility we've had to help our kinship families. Okay. So now I'm going to ask you some questions, and I'll be able to see some of the comments that are made, some of the chats and those things that you may have. So the first one I have is, are you currently using a formal kinship care program in your jurisdiction? And if not, what methods are being used to integrate kinship options into placements when needed? Man, there's 10 yeses right out of the get-go. Only one no. That's awesome. So I hope what I'm telling you guys isn't boring you, because I'm seeing a lot of yeses, that there are a lot of formal kinship caregivers there. So everybody knows the value of family. I see one comment there about via a contract with a local nonprofit, that's interesting, because one of the myths out there that we found was that we had the Kinship Navigator program both at our agency, and then we went out and found a building and provided it off-site. We found that it really didn't matter. As long as there was a service provided and the Kinship Navigators worked with the families, it didn't matter whether it was internal or an external component. They continue to work with us despite it being at the agency currently. So thanks for all those responses. That's awesome. There are an awful lot of yeses out there. Hopefully at some point we can all learn from each other, and all kids will have an opportunity to be placed with kin. And we know kin goes beyond grandma and grandpa. It's aunt, uncle, brother, sister, cousin, even fictive kin. So, all right, question number 2. What resources or community partnerships are you currently using to support kinship programs or placements? What additional resources or partnerships might be helpful? And I'm seeing some pretty interesting answers there as well. Maintenance, Medicaid, training support, absolutely. We are a standalone agency, so we're separated from our JFS, which means we do have a really good relationship with our Job and Family Services, but again, we try to make sure that whatever the caregiver is eligible for, they're receiving that benefit. And when they're told no or they don't qualify, we make sure that that's the case, or maybe they just don't have the appropriate documentation with them or what have you. A lot of good stuff there. Clothing, food, legal aid, all those things are so important to these people who are on fixed incomes that have opened their home, like I said earlier, to multiple children. So it's really important we provide as much care as possible to them to keep those kids in a permanent arrangement. And hopefully the biological parents get the support that they need, and the kids are able to return at some point. Because really, that's what these caregivers want. They want their whole family to get well. They're dealing not only with bringing kids in, but they're dealing with their biological kids as well. So any support we can give them is important. That is a huge list. Thank you guys all for responding. There's some really good information there. And now again, with the Family First and Services Prevention Act, we may all have at least a year to have opportunity to use some flexibility, all states, to provide services to kinship families that maybe some states out there were not able to, or jurisdictions were not able to. So we'll see how all that plays out moving forward. And we know that's going to be coming, the waivers are going to be coming to an end really, really soon. Okay. So how Title 4E supports kinship care. Implementing Protect Ohio within the context of the 4E waiver demonstration allowed public children's service agencies to address the lack of services available for kinship caregivers often seen within the child welfare system. We all know how traditional 4E works. You're getting paid for bringing a kid into custody. We decided back in 1997 that wasn't the way we needed to do business, and basically flipped our agency services. We were very backloaded, a lot of kids in foster care, a lot of kids in congregate care. We operated 3 group homes. We flipped the agency services to a bunch of preventive services, our Kinship Navigator program, and again was able to reduce our numbers from 283 to 44. Sad to say, currently, due to the current crisis we all know about that's hit the United States and counties as well, the opioid and heroin crisis has boosted those numbers a little bit, but we're still able to utilize many of our caregivers to find placement for those children and hopefully find the right resources, mental health and drug and alcohol resources for those biological parents. Again, the waiver allowed PCSAs to use federal 4E dollars to systemically change staffing and practice and policies and provide caregivers with services and supports they may not be eligible for under the traditional 4E funding approach. So bottom line is, if they didn't become foster parents, they were not going to be eligible for any of those supports. It would have to be whatever's out there in the community. We do not tell our caregivers, any of our caregivers, formal or informal, that they cannot become foster parents if they don't want to. Historically, what we've found, there are some that do, but many of them do not. They have the wish that their kids are going to get better and those children can be, be returned. And if not, they would rather take care of those kids. I can't tell you how many times I've heard them say, Tim, I'm glad you guys offer the services that you provide, but these are my babies and I'm going to take care of them. So that's why I take my hat and tip my hat off to these folks and give them as much encouragement as I possibly can, and encourage our navigators to respond to them with whatever the need. And it may just be a phone call just to have general conversation. So I check the red lights when I leave for work each day to make sure that there's not a red light on, because we could basically take care of a crisis if maybe we just would have answered the phone and provided some support to our caregivers. Challenges impacting families, we all know of those. I think part of this slide, what I was trying to say was we need to make sure that we're putting into secondary plans into place. You know, a lot of these caregivers are getting older, so there's death and chronic illness. You got to have a subsequent plan put together. Maybe there's other relatives, maybe there's family members that are saying they're willing to step up. So we do try to come up with a plan to assist those families with caregivers that may be a little bit older and getting up there in age. Other things that our families are dealing with, this is just local information: domestic violence, obviously substance abuse disorders, incarceration of parents, child abuse and neglect. The community mapping, again, has been important. We went through just about every agency in our county, put together a manual that all our caregivers have access to with all the resources that are out there in our community. I've contacted 211, our local 211. They give me information on the number of calls they receive from kinship families. They ask a little question like, are you raising a relative? And usually I only see maybe 2 families every month that they may be calling, which means we've saturated our county. People know that we're out there. People know that we exist, and we're really proud of that, that we provide that service to our kinship caregivers. Again, unemployment and poverty, another issue for these families, why the waiver and the flexibility has allowed us to keep these families intact, who otherwise probably would not be able to do it if we did not have funding to assist them when they need it.
Continuum of family resilience. Resilience, the power or the ability to return to the original form or position after being bent, compressed, or stretched. The ability to recover readily from illness, depression, adversity, or the like. Random House Dictionary, 1968, page 1123. A graphic of an arrow with 3 boxes across it. In the first box, the words overwhelmed, ineffective. In the second box, the words gaining control, functional. And in the third box, the words grounded, competent.
These families are resilient, and I'm not going to read that definition to you, but this is just something we talk about. Initially, when we place children with kinship caregivers, what we find is they're overwhelmed and kind of ineffective. They don't know where to turn. That's why we try to make it as calm as possible, provide as much information as resources as possible to them. Again, when we're doing that resource scale, you see that there's a lot of needs checked in there, or they don't have, or they need. And then as we move forward, you know, the next 90 days, we do the resource scale again. Then you start seeing them starting to gain some control, gain in function, because they feel supported, and they know who to turn to, and they feel like they get it now. They feel supported by our navigator staff. And then lastly, the ones that we may hear from every 6 months, or we may hear from a year, they're grounded and competent, and they actually will provide support to some of our other kinship families as well. The bottom line is the more support that you provide these people, the more information that you give these folks, they definitely become really important, not only to the kids that they have in their home, but to your agency as well. I can't tell you the number of them that I've taken with me in the community to talk about the services we provide here, and it's been really, really helpful for our community to understand. This is just a mantra that we use in all of our support group meetings that I talk about with all our caregivers, because they are the 5 Ps, and I use it whenever I can. These are very proud people. Now, sometimes that gets us in trouble when I say proud people. Some of these are old school folks, you know, and you got to be careful with, you know, how you're disciplining children and that kind of thing. But these are some very proud individuals and want to take care of their kin if possible. They're positive people. All of them that we deal with are you know, they're really strong individuals and open their home to more than, like I said, 1 child. They're persistent, they're proactive, and they're problem solvers. So that's just a mantra that we use within our support group meetings with all of our informal and formal kinship caregivers.
The slide titled Commitment to Kinship Services shows a photo of 2 hands, one gripping the other, and the logo for Richland County Children's Services.
One of the key things I think is that you have to be committed. You have to have the right people. You have to have the right people to do this type of work. Extensively, I've went through when we hired our Kinship Navigator staff and found people that I've worked with historically through the agency that really, want to work with this population of people because they can be demanding at times and they can stress you a little bit. But we really are dedicated to working with them. I think our county is very much aware of it. Again, we have 3 Kinship Navigator staff. I would encourage you guys, if I leave you with any parting messages, contact your state representatives and get them involved. Our local representative, I invited him down here to actually visit a couple of our kinship families, and it's an eye-opening experience and to see, I wasn't aware of that. I didn't know that was a problem out there, and we did get some additional dollars in our budget specific to daycare issues for some of our kinship providers, some additional funding in our child welfare programs. Ohio, I hate to say right now, is last in the nation as far as how child welfare is reimbursed by the state of Ohio. But I think they understand it, and it's really, really important that you get that message to your legislators and you get your representatives involved in what you're doing to help these families to keep them out of foster care and then keep them out of congregate care as well. So with that being said, here's some of the resources you can check out. That's where our manual is located.
Resources. The manual discussed can be accessed online at http://jfs.ohio.gov/pf-OF/pdf/protectohio-kinship-manual.stm. Logo for Richland County Children's Services.
Again, I hope I provided a little bit of information from the way those 2 poll questions went. I have some really experienced folks on the line. It was just an honor for me to talk with all of you, be part of this webinar. Looking forward to the next group of folks who present because I know them as well. And just continue to support those caregivers. Looking forward to what the Family First Service Prevention Act can do for the entire United States and in our efforts to continue to support kids and identify permanent homes for them. So thank you again. I appreciate it.
Thanks so much, Tim, for all of that wonderful information. We had a lot of great questions, so we'll make sure we get that at the end. And so now we're going to turn it over to Tyler.
Logos for the State of Colorado, the Colorado Office of Children, Youth, and Families, Division of Child Welfare, and the Colorado Department of Human Services. Colorado Title IV-E Waiver Demonstration Project.
Hi, and thank you. Thanks for having us. Actually, this is Tyler Allen. I'm the Title IV Waiver Administrator for the state of Colorado. And presenting with me today is Jeannie Brzezinska. She's our Kinship Supports Intervention Lead, as well as our Kinship Program Administrator at the state of Colorado. And so I've invited Jeannie to just jump in and interrupt me at any point if she wants, if she has other thoughts that she'd like to talk about on any given slide. I also wanted to take an opportunity to thank all of you for being here, spending your time listening to some of what we have to say. I'd like to thank in a huge way Tim Harless. As he mentioned, I know him for a while now going back. Colorado learned a great deal from Ohio before we kind of ventured into our own kinship supports programming, and so we want to offer thanks where it's due. A great wealth of information there. Hopefully, we'll try not to be too redundant with much of what he said, but Tim provided a lot of really great, meaningful content there. So, thanks again, all of you, for hearing me. It's an honor to be a part of this.
Colorado Department of Human Resources 4E Waiver Demonstration Project. A map is shown displaying Colorado counties.
To move forward, we want to start you out just kind of an introduction to our state in general. Colorado's a big square state. It's actually quite a big square state. I heard our governor on the phone, or on the radio, not on the phone, I don't talk to the governor personally very often, on the radio maybe a month or so back, talking about the state of Colorado, if you flattened it out, we actually have a larger surface area than the state of Texas. That becomes relevant later when I start talking about some of the boundaries, the geographical, very literal boundaries that happen in our state. But I just want to describe to you a little bit about what it is. We have 64 counties. We refer to the 10 largest counties. They're kind of the city population centers as either the Big 10 or the 10 large counties. And they account for, I think, about 85% of the population of our state. That's your cities like Colorado Springs and Denver and Boulder and Fort Collins, some of the bigger places. Obviously, there's some pretty big differences between the needs of people living in those communities versus in what we would call medium-sized or smaller size. Often we bundle them together as a balance of state counties. We have about 22 mid-sized counties, and then we have about 32 balance of state counties, which are very small population-wise, but usually very large geography-wise. There's a great deal of differences between those counties in terms of demographics, in terms of kind of political orientation, I could say. There's, as I mentioned earlier, a number of barriers and boundaries which can exist. Some of those are very physical. Some of those might be ideological between counties. Colorado prides itself in being a frontier state, and what that kind of means is the kind of more local you get, the more control we try to give. So Colorado is a state-supervised, county-administered child welfare system, which I know is not common to all states, but as I talk to more states about that, maybe the differences aren't quite as huge as it appears on paper there. Essentially, we have regional areas or counties that exercise a great deal of authority in how they administer their practice, and it's the state's role to make sure that practice is really in adherence to whatever rules there are, either federal or state rules, but also to support those counties in doing good practice and support the initiatives within those counties, support innovation within those counties. So often we'll have leadership kind of emerge in pockets throughout the state, and we try to learn lessons from them as much as possible, as well as looking around the country at other places. If we could skip forward, we just wanted to do a quick polling question. Usually when I'm talking about Colorado, I'm trying to talk very much of how unique our place is. But as I'm describing kind of the breakdown of how our state works, how you have kind of these areas of authority within the state that are all trying to do their own thing, all trying to meet the needs of their populations in their own ways with as much flexibility as possible. Just wanted to get a sense on a 1 to 5 scale, with 1 being not at all and 5 being a perfect match. How does what we're describing align with how you see your state? As I'm looking, I'm seeing a lot of 4s, some 3s, couple 1s, couple 2s, but largely it looks like the lion's share of respondents are kind of in that 3 and 4 range. So I think kind of the understanding that I've gathered sitting down after conference meetings that I've had with people talking about how their state is, even if it's a state-administered practice, maybe that's kind of consistent with what is actually happening out there, and that county-administered versus state-administered, maybe not so different. We all have the same sort of things we're trying to struggle with.
For the final polling results, 4.35% marked 1, 17.3% marked 2, 31.8% marked 3, 36.2% marked 4, and 10.1% marked 5.
I wanted to talk to you a little bit about the 4A waiver specific and how it's related to that kind of introduction of the state. Is as a frontier state, we want to see, we want to support our counties doing what they need to do for where they show their needs being. Maybe I didn't mention it before, what we tend to see is in our population centers, there tend to be a lot more resources available, and as you get more rural, it becomes more challenging to access resources for families. Different sorts of partnerships need to exist, and there's some challenges in place there. So we put our waiver in place with the intention of getting all 64 counties participating in the waiver. And in a very technical sense, they all are enjoying the benefit and inheriting some of the risk of being in the waiver. But in a more specific sense of terms, 53 counties are actively participating in at least one of our 5 interventions. We jumped into the waiver in 2012 with this kind of last cohort of waiver states. So in that, we're quite different from Ohio. In my conversations with some of these folks with Ohio, I understand that where we are starting off is very similar to where they started off, which is to try to have a number of different approaches, a number of different interventions, try to do them more broadly if possible, and then as they matured as a state, they really refined their programming into what was very effective for them. And so I think we took a similar swing into it. We started off very broadly, so there's a number of different practices which we think will improve outcomes and allow counties to jump in as they want to that. Counties very quickly jumped into this, and it became a very positive thing from the get-go that we were acting kind of together as a group of counties or as a state to driving these practices forward. So I've listed them all there. It's permanency roundtables, family engagement, which is similar to what Tim described with his program before. Our family engagement practice really takes the form of facilitated family engagement meetings, but they vary a little bit from model to model or from county to county. Some counties have multiple different models that they employ. And I think a lot of people see a lot of similarities between family engagement and permanency roundtable, which is a similar style of meeting that is designed for achieving permanency outcomes in tough cases. And then, of course, kinship supports, why we're here talking today, and you're going to hear a whole lot more from Jeannie, who's going to do the heavy lift of this conversation today. And then the last 2 interventions are trauma-informed assessment and trauma-informed treatment. Sorry, it should have been trauma-informed assessment and trauma-focused treatment. That was my mistake in the slide. But really, we bundled those together. I think of those as trauma services in general, because our philosophy is that in some cases, assessing for trauma in a child welfare world might come with some complications if you're not prepared to follow up with any form of services. So really those are bundled together. Any county that's doing one of those are doing 2. And like I said before, 53 of our 64 counties will have participated in at least one of those different waiver interventions. Oh, I jumped right into a polling question. So I guess these questions might be a little bit redundant right now because you already answered some of that with Tim. Does your state have a defined kin program? It sounds like a majority of the people that are listening in today do have some form of defined kinship program. I guess that I can jump to the next question, which is maybe more relevant then to this conversation, is does your state sufficiently address the needs of kin? I'm seeing about 3/4 of you, maybe a little bit more, that are more inclined to say, no, we're not sufficiently addressing the needs of kin. And I don't know that we as a state, I don't know that I would answer that question any differently than the majority of you are answering. I think there's a lot of room for improvement in how we work with kin. But I think this waiver has really provided us with an opportunity to shape the way that we're thinking about working with kin. We're shaping the way of acknowledging where our responsibilities are with kin, and acknowledging that we can achieve greater results by enhancing our partnership with kin providers as much as possible. and we can do so in a cost neutral or cost positive way, or cost negative, I guess, in a way that we're actually having a savings that we can invest otherwise, as opposed to using foster care. I agree with Director Harless that foster care is obviously a necessary service. It's something we have, but I think a lot of our use of foster care historically has been driven by that kind of old school mentality of the apple doesn't fall far from the tree. Often this is a challenge as we get into more rural communities or smaller communities where people generationally kind of know where their family are working with. So as we think in those terms, I think we're in a healthier place ideologically, both as a state and as a group of counties. And I think there's a lot of opportunity there to move forward.
Polling question. Does your state have a defined kinship program? 70% responded yes, 20% responded no, and 10% said I don't know. Second question. Does your state sufficiently address the needs of kin? 17.1% responded yes, 77.6% responded no, and 5.26% responded I don't know.
As we go forward, I'm going to turn it over to Jeannie so she can describe in some more detail what it is we're trying to do with our kinship supports intervention through the waiver and beyond and above the waiver. So with that, I'm going to turn it over to Jeannie.
Hi, this is Jeannie Brzezinski. I am here in Colorado with Tyler. And I know we had kind of had a slide previously about kinship care definitions. Wanted to share this briefly as Colorado does have kinship care defined in our statute. So we as a state have defined it as a relative of a child, person described by the family as having a family-like relationship or one who has a previous significant relationship to the child. And then if you hear me talking about non-certified kin, that really means kin who have not met certification requirements or have chosen not to pursue the process. Typically in those situations, the court will award temporary custody to the kin provider while they are still working on reunification with the parents. And then kinship foster are those kin who meet foster care certification requirements, though we do have waivers for some non-safety certification standards. So to talk a little bit about the kinship supports intervention, we'll keep it pretty high level, but still want to go a little bit into the details. We have two target populations. So those are the children and youth stepping down from higher levels of care, whether that be congregate care, a traditional foster family, or anyone that's kind of a higher level care than specifically a kin provider, or preventing entry or reentry into the system. So with these categories being pretty broad, that encompasses both our kinship foster and our non-certified kin families. We have two categories of eligible services, which is case management and support services. We've got a very lengthy list of what those entail. Okay, so that should be available at the end of the webinar with those two particular services. Case management really is going to be the services that they're getting from a kinship staff, whether that be a Kinship Navigator, someone within the county in general. We have a kinship needs assessment, which we will talk about, and that's and then under the supportive services, we have respite care, child care, kind of the basic hard goods, transportation, kind of those types of things. 35 counties have participated in our kinship supports intervention, so right about half. And then the $1,000 per family is just kind of a general guideline. So once they have completed the needs assessment, which I'll get into more detail in a moment, that will kind of determine what a family needs as far as their services. So when they're looking at the family, not every family is going to need $1,000 worth of services. So if you've got one family who has maybe 6 or 7 children who need maybe $2,000 worth of services, you've got 2 other families who have maybe 1 child each that only need about $300 or $400 worth of services. That actually will balance out. So as long as you're spending the $3,000 over the 3 families, it really was just a guideline for counties so that they're not, so that they had a way to kind of budget and what they could request as far as funding sources. So a general guideline, that's not a hardcore number.
A document is shown entitled Title 4E Waiver Kinship Supports Intervention.
So let's go a little bit more in detail in the service categories and also the kinship assessment. So here you can see our case management services, the kinship needs assessment, which we will go in a minute. These will be available at the end of the presentation. So the needs assessment has to be completed within 7 days of placement or the first contact with the family. For those where it's a prevention, so we're trying to prevent entry or re-entry to the system. An ongoing assessment is used anytime a new need is identified. So if a family is asking for a new service, they want to redo that assessment to ensure that all of the new needs are being identified versus just one thing and then having to keep going through this process. So you can see the coordination of services with the kin families and the providers, caseworker, also the kind of the treatment plans, strengths-based and consultation. So a kinship worker is assigned to each family. We do request an initial face-to-face contact, but then after that, the type and frequency is based on the wishes and needs of the family. So that could be by telephone, face-to-face, texting, email, or the family may say, you know what, I'm good, thanks, just kind of leave me alone. So the content of those contacts really are to discuss with the providers their concerns, finding out, just kind of a problem-solving, crisis intervention, conflict resolution. We all knew that there's some really unique dynamics when it comes to kinship care, and just because it's involving families. So is there a way to help resolve some of those conflicts within the family? And then you can see our navigation piece that really is more your information and referral, access to legal services. Training for kinship providers is typically by county. We do have a child welfare training system for the state of Colorado, and kin providers are able to participate in any of those trainings free of charge. So a lot of times they will utilize the same trainings that are used by our foster care parents, and so they do have that same access. And then also navigating TANF, Medicaid, child welfare, and community services. Now, as far as the legal services, Colorado is unique in that we have a program that is only available in a few states. We have a pro bono kinship adoption program. We have a partnership with a law firm, and they will provide pro bono representation on our kinship adoption cases. There's certainly a level of criteria, eligibility criteria. It has to be under 200% federal poverty level. They cannot have an open child welfare case, and they have to be willing to commit long-term to the child, and then the child must have been in their care for 12 months or longer. So this really is for those families who maybe had an open child welfare case at one point. The caregivers say, well, you want to take allocation of parental responsibilities, which is Colorado's word for custody. And then they realize a couple of years down the road that maybe the parents are not going to get it together and they want something a little more permanent. You can see, again, we talked about kind of the respite, the child care, basic needs, just those hard goods, transportation, all of those really kind of basic services that kin typically need. We do have a few optional services, attending family meetings and also going to court with the family.
The Kinship Supports Needs Assessment tool is displayed on screen. The form consists of space for a provider's name, type of assessment, and number and age of children, followed by an initial needs scale ranging from 1 to 5, where 1 represents no needs and 5 represents urgent needs. Ongoing needs and other needs scales using the same range follow. A section entitled Identified Supports, is shown. Two other sections follow, entitled Identified Supports and Moving Forward.
So this is our actual Kinship Needs Assessment tool. It is a front and back page. It's also available in Spanish. So, and then we'll talk a little bit too about the scale of how you would rate this. So really kind of what are some of those initial needs? Is the child coming with only the clothing on their back? Are the kin going to be caring for a baby and need a lot of those baby items? Bedding and potentially beds, food. You know, a lot of times kin will have, and I'm preaching to the choir, but have food that are not necessarily kid-friendly because they may have been living by themselves for a while. So just kind of those basic initial needs. And then the ongoing needs, you know, it's expensive, especially when it's not something you would put in your budget. So what are the financial needs that they have? Is there any advocacy needs, budgeting and parenting skills, child development, home safety or child proofing, that role definition? We've had a lot of struggles with that in our state between, you know, kin, especially if kin are living in the home and they are the primary caregivers, but that the parents are still there. It's really who is the parent when? So kind of really assisting in that role definition of who's providing the parenting. So then on the second page has some more of those additional ongoing needs, the mental health services, and then things such as respite, recreational activities, support groups. And as you go on down, we also have a section for helping the kin identify their own support network. Who are their immediate or extended family members that they can go to for help? If they have neighbors or friends or their church community, community-based organization. So really kind of helping them tie together of who that support network is that they can rely on, especially after our department's no longer involved. And then moving forward, you know, really going into their strengths, their worries, and their support plan to address the needs and next steps. Because the county department may not always be able to address every single one of these needs, but there should always be a support plan of how those needs can be addressed. Is there somebody in the community who can help provide to address those needs?
The Colorado Department of Human Resources 4E Waiver Demonstration Project Working Definitions. Informal agreed-upon definitions of the Kinship Needs Assessment Scale. A scale from 1 to 5 is pictured, with 1 representing no need, 2, low need, 3, moderate need, 4, high need, and 5, urgent need. A low need is not an immediate need, but possibly could be a need within 3 weeks or a month. Are there other resources that can help? Are there other factors that may have an impact? A moderate need is not an immediate need, but possibly could be a need within 1 or 2 weeks. A high need is an immediate need that must be fulfilled within the next few days. And an urgent need is an immediate need that needs to be fulfilled within 24 to 48 hours.
So the definitions that we came up with, and I think the one thing I need to really discuss is the relationship that the state of Colorado has with all of the county departments. All of these, the support categories, the kinship needs assessment, these different definitions were all done in collaboration between the state and counties. We have a very, very good partnership with all of our county departments, and so we have not done anything without the counties involved in this. So I can't stress enough the importance of the relationship between the counties and states, that none of this would have been successful had we not included our county partners. So really quickly, so no need is pretty obvious. A low need is not necessarily immediate, but possibly within the next month or so, going all the way to an urgent need being fulfilled within 24 to 48 hours. Again, so it's kind of just that scale of within. We wanted to put kind of concrete timeframes on that so that there was some consistency in how this needs assessment was being completed statewide.
I'm going to jump back in for a little bit as we talk about what we've learned through this. As Jeannie was describing our needs assessment, I realized one thing we didn't mention, and it was a learning lesson that we had in our waiver, is that we started out building this intervention with partnership from the county, thinking about what can we do, what should we do, what are the needs of kin that we're working with, everybody kind of collaborating, building this tool. And we built up this tool and how we think about this. And the learning lesson that we kind of came into was we're thinking of what we could do and how we could put this together. And then once we put it all together, we didn't have really solid ways of tracking what we were doing, what's the fidelity to this, how is the tool being used, how is it being documented. With any tool, there's capacity for misuse if you don't have clear guidance around this. So one of the things we did after the first year or two of this was built it into our SACWIS system, and that gave us a lot of potential for looking into findings. So the findings I have to show you right now has got our interim findings. So that was halfway through the waiver. Generally, how are things looking like they're working out?
Results are shown for an interim report covering the period from July 1st, 2013 through June 30th, 2015, showing an increase in placement with kin. There was a 9% increase in days with certified kin, a 39% increase in days with non-certified kin, a 15% decrease in days in congregate care, and a 12% decrease in days in foster care. The interim reports showed that the Kinship Supports intervention reached 73% of eligible caregivers. For the period of May through September of 2017, that number increased to 82% of eligible caregivers.
As we got, or what we'll be able to have for our final findings, which are due from HSRI, our evaluators at the end of this year, is that there will be a lot of more specific fidelity measures in terms of what identified needs were there on every needs assessment, at what level was the need. Do we have high and urgent needs versus low or no need? And then how frequently was there a service authorization that could match to those needs? So we're going to have a very detailed look, and we'll be able to say in a more specific way, when the needs assessment was used to a higher degree of fidelity, how has that shifted or impacted the outcome? But at the midpoint, without even that level of detail, we broadly saw permanency is increasing, that we have increased placement with kin for longer, that the intervention itself is reaching the majority, the vast majority of eligible caregivers within those waiver counties, and that as we move forward, that number has increased even farther. The one that I skipped over, which I think is a really fascinating one, is we were looking for correlations or connections between interventions that have been used. And one of the connection points, one of the most significant findings we found, that if a family is receiving both the kinship support and is moving through some sort of family engagement meeting practice, typically what that means is the kinship provider is part of the family meeting, their needs, their conversations are happening together. That child or youth is significantly more likely to reunify with their bio parents or with the parents. And we thought that was a really exciting finding, that maybe these two interventions have kind of a symbiotic connection. Here's so that's kind of the outcomes portion of the findings. Here's a little bit different look at it. This is kinship findings that we're hearing from the kin workers. And thank you for pulling up that slide. We sent out a survey last year to gather a little bit more information about what kin caregiver concerns are, what their thoughts are, what they wanted, so we can think, has our intervention targeted what we want it to target? And this will be available to you at the end if you want to kind of pour through and see, this is what kin were saying, this is what kin were thinking. But I think broadly, all of those little talking sign comments in there really speak to what a lot of caregivers were thinking about the connection they had to their kin worker, to the children they're working with, to being supported through the system. And I think we found that there was a great deal of need there. and that largely we're moving closer to satisfying some of those needs. We did have a good deal of responses to that survey that we actually sent out digitally to all the kin providers that we have recorded in our SACWIS system. And then I'll leave that to Jeannie.
So we wanted to talk a little bit about, putting a face and a name to it. So we had talked with Marilyn, who's one of our caregivers. She recalled one of her favorite memories from several years ago. At the tender age of 8 years old, Jack became a pet parent to a guinea pig named Remy. Marilyn and Jack adopted him from the Humane Society, and when they got home, Jack said, "Auntie, thank you for getting Remy out of pet foster care like you got me out of kid foster care." As the years went on and retirement drew near, Marilyn dreamed of traveling to destinations like Australia and New Zealand. Instead, she purchased a home near Jack's school and his friends. She went back to work and became one of the biggest advocates for other relatives raising children in Colorado. Marilyn credits the support of her local kinship group and the financial report she received from the 4E waiver kinship supports in her local county department and her success of raising Jack. Jack, now a teenager, says he enjoys living with his aunt the most. And a quote from Jack is, "I'm most comfortable with her." So really it just, I think Marilyn and Jack's story just kind of brings it home for us and why we continue to do this work. And in Colorado, we don't have it figured out completely, but we feel like we are on the right track, and our results are starting to show that. So with Marilyn's story, I will go ahead and turn it back over to Jennifer.
Thank you so much, Tyler and Jeannie, for all of that amazing information, and it's really great to hear a personal story from a caregiver. So thank you for that.
Tyler Allen, 4E Waiver Administrator, can be reached by phone at 303-866-2154 or by email at tyler.alen@state.co.us. Jeannie Brzezinskis, Kinship Care Administrator, can be reached by phone at 303-866-4617 or by email at jenniberskas@state.co.us.
Before we move to question and answer, I just wanted to share a resource that the Capacity Building Center for States has. It's a digital story learning experience, and so as I mentioned at the top of the webinar, we've done some digital stories on kinship care providers talking about the supports that they receive, in terms of supporting their their kinship families. And so they're really great videos that have a lot of really fantastic information in them. And so we've also turned those into a learning experience. And so they are really targeted towards agency leaders, training directors, and supervisors. They're specialized guides for each of those target audiences that can take folks through questions, view a story, take folks through questions to really get at the heart of the work that we do with kinship providers. And so it really provides an opportunity for reflective activities and questions for individual coaching, or you could use them to promote collaborative discussions with teams. And then there's also some templates for setting goals and action planning to really move through the learning process. So we just wanted to point you all to this this resource. Like I said, the digital stories are really amazing on their own, and then you can also use them in many different ways, as I said, with staff, with teams, even with community providers, to really bring home the point of how important it is to support our kinship care providers. So please go visit that website. And then I also just wanted to mention, you'll see at the top of your screen right now, there's an evaluation survey that you will receive after the webinar. And then also, if you're interested in receiving continuing education units, that will be available as well. So with that, we have about 15 minutes left. We wanted to make sure to get to all of your really great questions. So I know that there were some questions around some of the resources that Tim and Tyler and Jeannie talked about, and so those will be available at the end. So I just wanted to make sure to mention that. So Tim, I'm going to start with you. There is a question around the assessments that you talked about. So are the assessments expected to be completed with families that may not receive case management component of the program?
The resource scale, we do use it with informal families at times, but really it's supposed to be used with the cases that are transferred to ongoing. Our informal kinship caregivers, again, they do receive services despite not formally being involved with the child welfare system, but that's simply because of the flexibility that we have. We still want to know what their needs are, but the formal assessment for data purposes that HSRI uses is very similar to what Colorado uses. That is for families who have open ongoing cases where the kids are not currently with their biological parents, but are placed with kinship caregivers.
Great, thank you, Tim. Tyler and Jeannie, there was a question about the survey. They're wondering if the survey questions could be shared to possibly replicate in other states.
Absolutely. I'll have to dig around a little bit to find the specific questions, but would it be best if I shared that through you guys?
Sure, absolutely. We can make sure participants get the information.
Yeah, I'm happy to do that.
Great, great. Okay, all right. So Tim, I'm going to go back to you.
Okay.
So the question was around, in your statistics for kinship versus foster care placement, are children in kinship placements under any type of court order?
Some of those formal kinship cases are, and even some of the informal. It just depends on the circumstance. Again, many of the formal kinship caregivers currently do not have some form of custody at this moment because we're working reunification plans. But again, the flexibility in those two law firms that we have worked with, again, like I said, it's about 3 to 1, the informal families we're able to work with. We're able to provide at least power of attorney if the parents can't be located, a kinship caregiver affidavit. These are specific to the state of Ohio. And then additionally, to assist with some form of custody.
Great, thank you. Tyler and Jeannie, this one is for you. There was a question around how do you locate kin who might be eligible? Is this task done by the State Department or foster care agencies?
That's a great question. Typically, that's going to be done at the county level. And how we identify kin typically, I mean, it's through obviously intensive family finding. But those families that are eligible, as long as they are caring for a child that meets either of those two target populations, either they're trying to prevent entry or reentry, so that might even be a self-referral, or to step down to a lower level of care, then they would be eligible for services. So typically, they're going to be identified through the county departments because that's where they either would be referred or even self-referred.
If I could add a little bit to what Jeannie also said from a financing from a 4A waiver perspective, both the kinship supports and the facilitated family engagement interventions, we've allowed the flexibility in those interventions for counties to hire specifically intensive family finding workers, that's specifically their role. And then the other thing that's happening at the same time is we're becoming a DR state, so we're rolling that out. Differential response state, and so Genogram is part of that process, and really this is part of that shift in thinking to say, you know, what family resources are out there and how can we look at them as resources rather than further burdens, which maybe historically has happened.
Great, thank you both. Here is a question for all of you, so Tim, Jeannie, and Tyler. The question is, have you addressed the issue of permanency and stability, which some of our staff struggle with when we give guardianship to kin up front?
From Ohio's perspective, and I'm sure it'll be similar for Colorado, if you have supports available, this has become part of our culture. I mean, as I stated earlier, we're a legacy state here in Ohio, even though we're a 15-county waiver, because we were willing to take the risk, and the other 70-some or 60-some counties said, no thanks yet. We don't want to do this. But we took the risk, and it's become part of our culture. So really, we don't have that worry because we're able to support them after they've gotten custody, legal custody, or guardianship as well.
So in Colorado, we don't typically give guardianship right up front. They might have temporary custody because we really are working on reunification. But if it really comes to, it looks like reunification is not going to occur, then we are going to pursue permanency with a kinship caregiver, and whether that be through adoption. We do have a relative guardianship assistance program in Colorado, or our allocation of parental responsibilities. We really strive to have the highest amount of legal permanence possible, though, so we're really going to strive towards adoption or the relative guardianship assistance program.
Great. Thank you both. Tim, back to you. There's a question around what role did the Kinship Navigators have in establishing the program, or was the director the primary contact in the development of the program?
Again, we had been doing this similar to Colorado and found that we had several different strategies, and we actually narrowed those down to family team meetings and kinship supports. Obviously, it comes from our administration. Your administration has to believe, and then it all trickles down to your supervisors, your line staff, and then your Kinship Navigator staff. Referrals are made by our staff, internal staff, directly to our navigators. There's an actual referral form that's used, and they give specific information on what they need. And then we take it from there. So they're continuing to work the case plan with the family and so on and so forth, but our navigators are an extra set of eyes and ears and another bit of assistance to our workers. So they really respect the program and enjoy having those folks service those caregivers when they're trying to work reunification, if at all possible.
Great, thank you. So, Tim, there was another question that came in for you. Does Ohio's evaluation of their navigators show them as an evidence-based model or promising practice? Therefore, hopefully making... Oh, go ahead.
I was actually biting at the chomp to answer that question. With the California Evidence-Based Clearinghouse, we know that with the Family First Services Prevention Act, it has to be at least promising practice and then supported, well-supported, and possibly evidence-based. We do believe that we have data and empirical information that we can get this submitted to the California Evidence-Based Clearinghouse. We're working with our evaluators, HSRI, currently, hopefully to get that done. But yeah, we're thinking that we may be able at least to get this part of a promising practice. So that is an absolute great question, because if you're reading that new law, it's at least going to have to be a promising practice and then move through that evidence-based process.
Great, thanks, Tim. Jeannie and Tyler, there was a question that came in when you all were talking around what percentage of your kinship homes are able to become certified?
That's a great question. We actually, in our rules, every kin provider has to be given the option to be certified or not. If they can't be certified, it's typically because they've got something in their background that would preclude them from being a certified foster parent. Majority of kin actually choose not to be certified. I would say we probably only have maybe a 10% certification rate currently, and it really depends on counties. We do have a few counties who will not use non-certified kin, but they require their kin to be certified. And then we have a good chunk of our counties who give the option, but the kin, they just don't want to go through that certification process. They would prefer to use child-only TANF, and they choose not to. So really any kin provider who is coming into our child welfare system has the opportunity to apply, but I would say only about 10% actually do become certified.
And I should also add to that there is the capacity, if there are certain non-safety standards in terms of the home, that can be waived on a case-by-case basis. So it's really hard to answer that question of what percentage are not able to be, because it's hard to pick out what percentage just choose not to be from who can't. And even of those who are not able to become certified, there might be some capacity for them to be certified through a waiver of certain non-safety standards.
I would say the percentage of those who cannot be would be very minimal.
Yeah.
Got it. Great. Thank you. And we're just a few minutes from the end of the webinar, but I did want to make sure to ask this question, and maybe one of you all can answer this. There's been some questions around sustainability of your guys' programs after the waiver ends. So maybe if one of you could respond to how you're planning to do that.
Go ahead, Tim.
I will go quick and give you guys time, Colorado. Right now, we're meeting as a state because this is not going to be a county issue anymore. It's law, so the state is going to have to come up with a plan, put it together, submit it to the federal government and HHS to get it approved. So we're working on that as we speak. Obviously, there's an opportunity to have 2 years before you implement, but then you're going to go back to traditional 4E funding, which is going to be odd to us. So we're having really interesting conversations around that, trying to get the whole state to move forward. But we believe that since we have completed this waiver, that a lot of the states have seen some of our information, or a lot of the counties have seen our information, will move forward as a state and get something submitted that everybody can work with and live within those guidelines.
I know that was a thing that was on Tim's mind to talk about, and I support him exactly what he said. We're in very much the same place. I'll also say that one of the things we've found is with our use, we believe with our use of kinship supports intervention, we've dramatically increased our kin placement. Many of those are not certified payments by their choice, and like what Tim showed in his kind of budget breakdown, it's dramatically more expensive to place into foster care or higher levels of care than it is to use the families working with it. So part of it is what portion of those savings can we reinvest in other services. So our whole waiver plan was to shift our placement expense costs onto prevention services, and I think we're really optimistic, really hopeful that Families First Services Prevention Act is going to support that.
Great. Thank you guys for responding to that. So with that, I want to thank David Kelly and Taffy Compain for their support, and for Tim, Tyler, and Jeannie, all of the wealth of information and knowledge you all shared with us today. Like we said, you'll be getting an email with the evaluation and the CEU information, the documents and resources that your presenters talked about today are available in the files download pod. If there's any questions, please feel free to reach out to us moving forward. So thank you all for attending today's webinar and supporting National Foster Care Month. Thank you all.
Logo for the Capacity Building Center for States. Contact us. Website, https://capacity.childwelfare.gov/states. Email, capacityinfo@icf.com. Phone number, 844-222-0272.